As we've been following over the last few months, of course, the surging coronavirus case count here in the U.S. Has stressed hospitals across the country, as well as the healthcare system writ large. But digital health could help avoid some of those impacts in the future. And joining us now for discussion on that is Yahoo Finance's Anjali Kamlani, who has Dr. Stephen Klasko, Jefferson Health CEO. And Anjali, I'll send it to you.
Thanks, Zach. Dr. Klasko, thank you so much again for taking the time to join us. I know there's a lot going on in the background, obviously, with just dealing with the pandemic as the head of a hospital, but also, everything else that has come from this pandemic. There's been a lot of learning and a lot of digitization and virtual sort of learning, for the hospital system itself. And I know we've talked a lot about this before, but I wanted to actually just start on vaccinations first, because that is sort of front and center right now. We know that there's a lot going on. The federal government just announced that it's okay to start vaccinating anyone 65 and older. And I think a lot of this sort of shines a light on the significant role hospitals are playing, but also there was some criticism about, the state mandates and dealing with the CDC priority group. So let's hear it from you. Where do we stand right now, on that, and just the idea of moving from priority group to priority group?
Yeah, well, thanks, Andrew. It's great to be on with you. Look, we have 14 hospitals in 2 different states. Both states have very, very different regulations. And so I'm very proud of what we're doing, what our colleagues are doing. We're starting off with our 30,000 employees, obviously the frontline employees first. But you're right, it's been very inconsistent between states as to how they're distributing, what they're allowing. In some respects, the best thing that could happen, it's been true throughout the pandemic, is to let the hospitals and the health systems really determine themselves and come to the states with a plan. That's what we've tried to do. But in some cases, the edicts, if you will, from the states have been very inconsistent.
And it must be hard to really adjust to that, in addition to sort of the uncertainty of operating the hospitals. Walk us through what that's been like for 2020. There was clearly a drop on things like surgery, but you also just constantly had the flow of people. What are you looking at in terms of learnings from that and how to operate more efficiently going forward?
Yeah, so look, in some respects, it was the perfect storm in a place like Philadelphia. We were right in the center of both the financial tsunami and the obviously medical and social tsunami, and also the reawakening of the understanding of race relations in this country. We're the second largest employer in Philadelphia. I lead a 2-campus university. We were one of the few places that actually kept students there, and then we're the largest health system. So look, I think the learnings are things that we sort of knew already, but that we've accelerated. We have a sort of sick care hospital-centric model. We've been moving at Jefferson to what we call healthcare at any address. That really helped us a lot. So, we talk a lot about telehealth, but think about this, Anjali. In my age 30 years ago, we would have been talking about literally depositing checks in a bank every other Friday because everybody would have been lining up. But we don't talk about telebanking. It's just that banking went from being literally very bank controlled to literally being able to be done at home. I said this at the World Economic Forum. One of the heads of a finance company said to me 30 years ago, the 2 least consumer-centric industries were banking and healthcare. And then he stopped. He said, now you're alone. So at Jefferson, we've been really trying to look at how we can get healthcare out to people starting at home.
And I know that one of the sort of foundational things that need to be addressed, and you and I have talked about this briefly, is a broadband connection, or just the idea of getting internet to people that don't have it, in the digital divide. We saw that come up in the educational space for K through 12 when schools were closed. But what are your thoughts on that right now and how that can be achieved, especially as we look to, increase telehealth, remote monitoring, and things like that?
Anjali, if I was the head of Health and Human Services for the Biden administration, one of the first things that I would do, or the head of education, is exactly what you said, is that we should make broadband for all an absolute. That's a big part of the health inequity issue. I mean, think about this. If you were from a certain zip code in Philadelphia, you had a 4 or 5 times chance of dying of COVID than if you were from a different zip code. And some of that is because you couldn't access things like telehealth if you didn't have the right broadband. There are countries in this world that have made that an absolute priority. We should look at broadband, Anjali, like we look at electricity and plumbing, and that should be one of the major things. You mentioned education. In Philadelphia, we literally had to limit some of our K-12 teleeducation because we felt it would, if anything, expand the gaps in education because certain people didn't have that. So there's very little that can get done anymore as far as getting care out to where people are if we don't start off with that as sort of a seminal program.
Certainly a conversation to have with all the broadband companies. Dr. Stephen Klasko, CEO of Jefferson Health, thank you so much for joining me today.
Anjali, great to be on with you and really appreciate the questions.
Zach, back to you.
All right, Anjali, appreciate that. I want to hit a news alert here that we have in terms of international visitors here coming to the U.S. The CDC expected to deliver a new mandate for testing there, according to Dow Jones, that could come as soon as today, that would require all international visitors to test negative and show proof of a negative coronavirus test before boarding flights to the U.S. Again, that coming from a report from Dow Jones stressing that now international visitors will need to show a negative test. It's expected to go into effect beginning January 26th, according to sources to Dow Jones. Very interesting to see there. I should stress that the U.S., of course, has by more than a 2-to-1 margin the most cases across the world for coronavirus, leading India by more than 10 million total cases there. So interesting to see that come through. But again, the CDC expected to issue that directive as soon as today.